outcomes. As a patient, outcomes can be very overwhelming. In short, we all want to know what will life look like for baby and our family in the presence of a fetal anomaly. We also want to know what the expected results will be for any treatments being considered and what will be the consequences of decisions we take as parents. As we have seen throughout this course, as varied as fetal anomalies are, outcomes can also vary widely. Outcomes depend heavily on these factors and more: the type of anomaly, which organ and how many systems are involved, severity, being major and minor, whether the anomaly is isolated or is part of a syndrome, meaning a pattern of anomalies that occur together, causing a cascade of subsequent abnormalities, the timing of diagnosis and intervention if possible, and access to specialized care.
An informed maternal fetal medicine specialist is usually the person initially informing the pregnant patient that there is a fetal anomaly. And they should also inform expectant parents regarding outcomes and management options. Given the very wide range of outcomes and management of fetal anomalies, a general discussion is not possible. But it's vital to know that some conditions are amenable to fetal therapy, and others are best managed immediately after birth at a fetal center with specialized services. Knowledge of these treatment options should be made available to all affected families. NAFNet, which is the North American Fetal Therapy Network, consists of 50-member hospitals experienced in providing the necessary information and directing appropriate fetal care. Currently, open fetal surgery, fetoscopic surgeries, shunts to relieve blockages temporarily, and exit procedures, which are done immediately after birth while the baby is still connected to the mother. These exist for many conditions, including open neural tube defects, congenital diaphragmatic hernia, complications of monochorionic or identical twin pregnancies, specifically the twin-twin transfusion syndrome, cystic lung lesions and pleural effusions, lower urinary tract obstructions, large neck masses, heart defects, and severe swelling, which is called hydrops. Fetal blood sampling is a less invasive intervention than surgery, but it is used to diagnose, treat, and monitor various fetal problems such as fetal anemia. And there are other fetal conditions such as a dangerous arrhythmia, which can benefit from therapy administered to the mother. The fetal centers are the specialists who will provide and monitor both the invasive and the non-invasive medical interventions needed on behalf of the fetus.
Even when a diagnosis is serious, families and medical teams find paths for support, care, and maximizing quality of life. Advances in fetal surgery, neonatal care, and therapy have improved outcomes in many circumstances. Your story is in the process of being written, and we encourage you to have a detailed conversation with your clinical care team. Your team will include fetal specialists that are experts in your baby's organ systems affected, the anomaly that you are experiencing, or the type of fetal therapy being pursued. If you do not have this type of support today, please reach out to our team of coaches. We are happy to find you a fetal care center of excellence in your area.